Hello everyone, am I audible and visible? Let me know. Okay, fine. Hello everyone, welcome to my class. I am myself Dr. Deepthi Kare. I am the PhD Physiology and your educator for Physiology. Now, so today we'll discuss about one of the important clinical aspect of muscle physiology, that is electromyogram. Okay, that is one of the important topic clinically that may be asked as a question, as well as we will also discuss about certain disorders of the muscle. Okay, fine. So before starting the class, I would like to inform you all that you will get all my physiology notes in soft copy as well as hard copy. To get the soft copy, you have to download the application Vesalius and you have to subscribe, and for hard copy you can order the book Physiology Notes, and this is available on Flipkart as well as on the Amazon. Okay, link for all that is given in the description box. Link for the book, link for the application also is given. Hello Kishan, welcome to my class beta. Okay, fine. Now another important announcement here is I also have started my WhatsApp group, so you can join my WhatsApp group. The link is given in the description box, or you can message directly me on this WhatsApp number, that is 78638 22668. If you have any query regarding physiology, okay, you can ask me at any time. I'll try to give answer as soon as possible. Fine. Okay, now let us start today's topic, that is EMG, electromyogram. So today's learning objective is EMG, that is one, and second, that is we will discuss about disorders of muscle. It is very important for MBBS, physiotherapy, nursing students, because you will come across in your second year and final year, you will come to face this kind of patients having different disorders like dystrophy, myopathy. Okay, so we will discuss, just starting from the physiology, we will discuss some aspects of pathology here. Okay, so stay connected, try to understand. At least you must know that what is there in this disorder, what happens, what is the pathology may be there in this disorder. Okay, so we will discuss. Let us start. Starting with first is EMG. This is more important for physiotherapy students, because you will have to perform this EMG in your second and final year. Okay, so this is electromyography. Okay, or electromyograph. Okay, so what is electromyography? It is the technique of recording, just a minute, of recording electrical activity of the muscle, and the nerve which supply it, muscle and the nerve which supplies it. So you can see here there is electrode which is placed on the muscle, it gets stimulated, and which type of electrical activity that appears, that is recorded. This is electromyography. Fine. Like ECG, electrocardiogram, here this is electromyogram, muscle. Fine. And the instrument used for this is known as electromyograph. Fine. Now we will discuss what happens, which type of recording you will get. Suppose you can see here, this is the recording you can see here. Now I'll just show you again. Yes. So you can see here EMG at rest. Suppose if you are not performing any activity, you are at rest and you are placing the electrode on the muscle and recording which kind of record you have. So you can see here, you may find, hello Ashish, welcome to my class. So at rest, okay, what happens? There is complete electrical silence. You can see here this kind of silence, no electrical activity is found. Okay, then so no spontaneous activity. If there is no nerve supply, or you can say there is no action potential transmitted through nerve, there is no muscle activity. Fine. Now next thing is, when you are inserting a needle here, how to record electromyograph, you can see here in this diagram, we are inserting needle here in the muscle and we are recording the activity. So when we are inserting needle, there is insertion activity. You can see here, sorry, I'll just show you. You will find, I'll just show you. insertion activity. Okay, at the time of insertion we have some activity. This is insertion activity. Okay, now this insertion activity, this will not be prolonged. Okay, so if insertion activity is prolonged, you can say that the person is having denervated muscle nerve supply is been removed, denervated muscle. Okay, and this insertion activity is absent when muscle tissue is not viable. Viable means living. So suppose if the person is having any muscle disease, you will not find any insertion activity. No, muscles are not viable, then no insertion activity is found. Okay, am I clear? So this is the normal physiology. Normally what happens at rest, we don't have any activity, no activity when the muscle is at rest. Okay, in EMG. Second thing, when you are inserting needle, there is slight activity because of insertion, but this insertion activity is prolonged if the muscle is denervated, and this insertion activity is absent if the muscle is not viable. Viable means live tissue. Okay, another important thing you can record is end plate noise. Okay, end plate noise means after insertion activity, suppose you have inserted the needle, there is no spontaneous activity. Spontaneously, if no action potential is there, there is no activity. Fine. Okay, for monophasic negative action potential, that is found in the end plate, we will find slight activity, that is known as end plate noise. A slight amount of action potential, Brownian movement is there, that produces end plate noise. Okay, so that may be found, otherwise no other activity is recorded. Now next is voluntary activity during muscle contraction. You can see here when muscle contracts, you can see here this kind of voluntarily contractions are recorded. This is the recording you can see here. Depending on the activity, means suppose voluntary contractions are minimum, you can see here slight activity is found. Single or two smaller motor units are recruited. So what happens? You will get slight activity. And when muscle contraction, voluntary contraction increases, you can see here, you will find large amplitudes. Okay, so firing rate increases and frequency also increases. Why? Because more and more motor units are recruited. Fine. So this is voluntary activity during muscle contraction. Okay, now when there is maximum contraction, you can see here all the motor units are recruited. So you will find MUP, motor unit potentials. Okay, this motor unit potentials, they are superimposed on one another. You can see here multiple motor unit potentials are found, and you can see they are superimposed on one another on the oscilloscope screen, and we cannot record individual recording. You can see here one over the other you will find. Okay, so this is normal pattern. Why? Because the contraction is maximum, so multiple, you can see here like one over the other, multiple, you will find this kind of motor unit potentials are present. Fine. Now, abnormal spontaneous activity. Abnormal are mainly two types, fibrillation and fasciculation potential. Now, what is this fasciculation potential? It is like MUP, motor unit potential, we have seen. Okay, we have recorded previously here in this previous one. This one, it is like this, motor unit potential. Okay, what is the difference? Fasciculation potential, they look like motor unit potential, and they represent involuntary contraction of the muscle fiber of single motor unit. What is fasciculation? Fasciculation means there is twitching contraction of the muscle. Muscle shows slight twitching. So when muscle shows twitching, you will find this motor unit potential. Fine. So these are here. I don't have the diagram of motor unit potential. I have the diagram of fibrillation potential. Now, what is this fibrillation potential? You can see this one. These potentials are short duration is short, and low amplitude. This is duration, this is this one, and this is amplitude. So duration and amplitude are less than your normal motor unit potential. So fasciculation and fibrillation potentials are abnormal spontaneous activity. So this is about your EMG, electromyogram. Okay. So if you have a short note, you have to write down, or whenever you will go to clinics and you will come across this EMG recording, you must know what is this. Okay. Now we discuss about the applied aspect, very important one, that is disorders of skeletal muscle. Okay. Myopathies. Now what is myopathy? Myopathy is defined as neuromuscular, you can also write down along with me, neuromuscular disease in which dysfunction of muscle dysfunction of muscle fiber, single muscle or muscle fiber, that leads to, because of this you will be having muscle weakness. Okay. Here very important thing, there is mainly myopathy, means you can see muscle weakness mainly. It may or may not related with nervous system. Am I clear? I repeat, what is myopathy? Neuromuscular disease in which muscle fiber disorder that results in muscle weakness, may or may not related with the nerve disease or nervous system. Okay. Now we will discuss some common diseases of skeletal muscle. Very important thing, so many times it may be asked as a short question. Okay. So we will discuss all one by one. One is muscular dystrophy. Second, muscle tone, we have discussed in our last class. Myasthenia gravis, fibrillation, denervation, hypersensitivity. Lambert-Eaton syndrome, and McCall's disease. All are very important. Okay, we will discuss one by one. Starting with myopathy. Okay, disorders of skeletal muscle, generally they are known as myopathies. Okay, now, so starting with muscular dystrophy. Now, what is this muscular dystrophy? Here, it is genetic disease, so it occurs due to mutation in the gene. Genetic mutation leads to muscular dystrophy. Okay, and characteristic feature is it is characterized by progressive muscle weakness. Muscle gets weakened. Progressive muscle weakness. There are two types of dystrophy. So many times this question may be asked, and you will come across this kind of patients in your clinics also. Duchenne muscle dystrophy and Beaker's muscle dystrophy. We will discuss one by one. Now, so here, starting with Duchenne muscle dystrophy. This is, first of all, what is this dystrophin? First of all, I'll discuss genetic aspect. As I told you, this Duchenne muscle dystrophy, that is because of the congenital defect in the gene. Okay, so this very important thing, it is sex-linked recessive disorder, means females are carriers and males are sufferers. Why? Because males, they have only one X chromosome, and this is X-linked or sex-linked recessive disorder. This gene of dystrophin gene, that is present on the X chromosome. So if this gene is absent, you can see here, this is the gene. When the gene is absent, you can see here, and if mother is a carrier, chances of baby boy having the disease are there, and female child, she is again a carrier. Fine. So this is sex linked recessive disorder. Like Hemophilia also, it is sex-linked recessive disorder. Now, what is dystrophy? Dystrophy is important for stability of sarcolemma. Okay, so when the sarcolemma stability is lost, muscle gets weakened. There is pseudo hypertrophy. Pseudo hypertrophy means muscles are enlarged but they are weak, so it is known as pseudo hypertrophy. Okay, I will explain. Important thing, you can see here, what is this dystrophy? You can see here, this is, I'll just show you. This is dystrophy. Now, what is dystrophy? It is large rod like protein. Okay, and this protein, it anchors your thin filament actin filaments to the membrane spanning domain, that is your alpha dystroglycan and beta dystroglycan. You can see here this dystrophin, it connects actin to the beta dystroglycan here, and this beta dystroglycan is connected with the alpha dystroglycan. So, whatever force is there on this actin, this is transferred to the alpha and beta dystroglycan. So, this maintain the stability of the sarcolemma. Okay. So, when the dystrophin is not present, okay, when or dystroglycan is not present, then there is disease which is known as Duchenne muscle dystrophy, and gene for this is present on the X chromosome. Okay, am I clear? Now, next is Beeker's dystrophy. Here, this is also sex-linked disorder, but the difference between Duchenne and Beeker's dystrophy is, in Beeker's dystrophy, you can see the gene is not absent; it is only reduced. Okay, so the symptoms are not very severe. Decreased quantity. Okay, or you can say dystrophin gene is altered, whereas in Duchenne dystrophy the gene is absent. Fine. Now here the symptoms are, the person is having same, some of the symptoms are same: muscle weakness, person is having pseudo hypertrophy. Commonly, very important thing here is calf muscles are involved. You can see here, calf muscles are involved. Muscle weakness, pseudo hypertrophy of the calf muscle. The person is having difficulty in walking, myalgia, pain in the muscle. Cognitive functions are affected. The person gets easily fatigued. Okay, and because cognitive functions are affected, so the person is having mental retardation. Okay, so let us remember muscle weakness. There are 5 symptoms you have to remember. Muscle weakness, 1. Second, pseudo hypertrophy. Third, walking difficulty. Fourth, fatigue. And 5, mental retardation. Okay, so these are the symptoms. Now, another disease, that is myotonia. Now, what is myotonia? Here, this is also clinical condition. Very important thing here is contraction is continuous and relaxation is slow. Continuous contraction and slow relaxation. You can see here the limb is contracted. No, it is not getting relaxed. This is also genetic disease, congenital disease. Okay, here it is because of disorder causes, because of abnormal gene for the sodium and chloride channels. Okay, so this channels are abnormal, so the person is having contraction of the muscle, no relaxation, and it is, the abnormal gene is present on the chromosome number 7, 17 or 19, this chromosomes. Okay, characterized by, you can see here, continuous contraction and slow relaxation. Fine. The person is having stiffness of muscle, sometimes muscle cramps are also present, okay, and the person has difficulty during simple actions. Person cannot walk, person cannot grasp, okay, hold, grasping, okay, chewing. This act cannot be possible, okay. And as I told you, gene mutation for the sodium and chloride channels, and these channels are present in the sarcolemma, cell membrane of the skeletal muscle cell. So when these genes are absent, you can see here the person is having the disease myotonia, continuous contraction and slow relaxation. Fine. So this is another disease. Third disease, we all are knowing, I'm not going in much detail. I also have discussed previously myasthenia gravis. What is myasthenia gravis? That is neuromuscular disease. Okay, disease of neuromuscular junction. Here, autoantibodies are produced against the acetylcholine gated channels. Antibodies are produced against acetylcholine receptors. Okay, so what happens? Now acetylcholine cannot bind with its receptor. You can see here this one. And you can say that there is no muscle contraction. Small muscles of the face are affected. The person is having ptosis. The person is having difficulty in chewing. Extraocular muscles are affected. So the person is having diplopia, double vision. Okay, so these are the clinical features. Next is myasthenia. Next is Lambert-Eaton syndrome. This is also neuromuscular disease, but the symptoms are same. The person is having muscle weakness, but the pathology is different. So clinical features are same as myasthenia gravis, but the pathology is here. Antibodies are produced against, you can see here, calcium channels. So what happens? Your calcium channels cannot open, and there is no rupture of vesicle and no release of acetylcholine. Okay, so this is Lambert-Eaton syndrome. Fine. Now next is disease affecting tone, muscle tone. Either the tone is reduced or increased. Reduced, that is known as hypotonia, and increase is hypertonia. Now, what is tone? Yesterday's class we discussed tone is a state of partial contraction in the muscle. Okay. So when the tone decreases, the muscle becomes flaccid, loss of tone, flaccid paralysis, lack of firmness. Firmness is lost. Okay, and that is commonly because of lower motor neuronal lesion. Fine. Then hypertonia, tone is increased. Okay, sorry, the tone is increased here. The tone is increased, and here you can see the person cannot stretch the muscle. The cause commonly that is because of upper motor neuronal lesion. Okay, here when the tone increases, we have two features. Yesterday also I discussed spasticity and rigidity. Spasticity means increased tone in one group of muscle like flexors or extension, and rigidity means increased tone in both flexure and extension. Like decerebrate animal is having rigidity, so increased tone in both flexure and extensors. Fine. Okay, so rigidity means both the flexure and extensor tone increases, so the limb becomes rigid like pillar. Person cannot flex nor extend the limb. That is rigidity. That is hypertonia. Rigidity is found in decerebrate animal. Okay, as well as in Parkinson's disease also we have rigidity. Fine. And spasticity is found in upper motor neuronal lesion. Okay, fine. So we discussed. Now next is fibrillation and denervated hypersensitivity. Now, what is here? Denervation means, suppose if you are removing the nerve fiber, you can see when this nerve fiber is cut. So what happens when you cut the nerve fiber which supplies the muscle? What happens? there is denervation. Now fibers are removed. Okay, so this is denervation. You can see here in this diagram. Now what are the effects of denervation? The person is having hypersensitivity, means you can see that acetylcholine, if it is released in small amount, then also large amount of response is found. That is known as hypersensitivity. That is one feature. Second feature is fibrillation. Fibrillation means the person is having, what is fibrillation? Fine irregular contraction of individual muscle. Okay, fine irregular contraction of the muscle, that is known as fibrillation. Fine. Okay, last one, very important still, that is Meckel's disease. What is this Meckel's disease? You can see this is normal muscle contraction. This is in Meckel's disease. What happens we will discuss. Here, this is glycogen storage disease. What happens here? Glycogen is normally what happens when we are performing exercise. Our glycogen is converted into glucose and our muscle uses this glycogen. You can see here normally in normal muscle. Okay, but in Meckel's disease, because there is mutation of the gene for the enzyme. The enzyme is muscle glycogen phosphorylase. Okay, this enzyme is absent because the gene is absent. So what happens here? This glycogen, this enzyme is required to convert glycogen to glucose. Okay, so now this is absent, so this glycogen is not converted into glucose. You can see here. So when the person is performing exercise, the muscle requires glucose. In normal individual, what happens? Now this glycogen is converted to glucose by this enzyme glycogen phosphorylase. But in Meckel's disease, this glycogen phosphorylase is absent. So the person cannot convert glycogen to glucose. So glucose level is reduced. Muscle is not getting glucose. So what are the clinical features? The person is having muscle pain while performing exercise because not getting glucose, and stiffness. This is Meckel's disease, one of the important disorder of muscle. So this is all about, we have discussed muscle disorders and EMG. Okay, again these are the all the questions. You can write down also, you can take a screenshot. These are the short questions asked from today's topic. What is EMG? Electromyograph, EMG finding, EMG changes, fasciculation, muscle dystrophy. Okay, Duchenne muscle dystrophy, Beaker's dystrophy, myotonia, fibrillation, denervated hypersensitivity, and Meckel's disease. Okay, so these are all the questions may be asked from today's topic. Again, I repeat, if you wish to get all my notes, physiology notes, you have to download the application. This application is available on the Play Store. Download the application Vesalius for anatomy and physiology and subscribe the same. And if you wish to get hard copy, you can order my book Physiology Notes, that is available on the Flipkart and Amazon. Link for both are given, link for the physiology notes as well as link for the application is given in the description box. Another important announcement, I have started WhatsApp group 7863822668. Okay, so join my WhatsApp group. Link is given in the description box, or you can message me and you can join my WhatsApp group. Fine. Another important thing, we'll be having, there is promotional offer we'll be having tomorrow. We have a draw, lucky draw of all these WhatsApp participants of my group. Okay, so please join the group as soon as possible and ask all your friends. And the winner of the lucky draw will get copy of my book Physiology Notes. Okay, so only one draw is there per month. Okay, this is promotional offer. So join my group. Either you can message me or you can join with the help of WhatsApp link that is there in the description box. Okay, fine. Thank you so much. If you like my video, like it, share with all your friends.